and just want to thank you for my coach Jen and of course Dr. Ovadia. And in November 2022, I got this wake up call with a CAC calcium coronary artery calcium score of over 2,300, and that was whoa! I didn't know I had any problems with my heart. I've always been athletic and slender, and my primary care physician calls me his model patient regarding my diabetes control and so forth. And so it was really a really surprise. And so I found Dr. Ovadia and his book. His book became my treatment plan. Looking at those 5 biomarkers for the metabolic health, and I was good on 4 of them, but one of them wasn't, and that was my glucose. It just wasn't down where it should be, and I found out as I continued to do more learning from our group coaching and Jen, that the diabetes was my major risk factor for a future cardiac event. And so that became the focus. Dr. Ovadia really helped me with making that a focus of the treatment plan, as far as bringing that down. I was around in the 6s, low 6s, 6.3 or so in A1C. And so my accomplishment, my success, was the carnivore meat-based approach of eating, which I don't see as a diet at all. In fact, I was just finished Gary Taub's latest book. This just came out after the first of the year, called Rethinking Diabetes. And he had a statement about that patients that doctors ought to see patients as with a reasonable assumption. They will think of how they eat as sustaining their health, not sustaining the diet. And I think that's really what I really appreciate about Dr. Ovadia and his approach and his team, was focusing on how the of my health, metabolic health, and how to do the principles of health, and looking at the whole system. I'm like Bruce talked. I'm systems thinking too, and so those are, I think, the using the chronometer, the CGM, the chronometer, so I could track both my intake and how that affected my blood glucose levels, really helped a lot. And getting just how to do meat-based eating so it was really sustainable. And now it really, I think I'm making it that way.
So what Dave's talking about is this little device that Dr. Ovadia can prescribe that just tracks your blood sugar every 5 minutes or so. Oh, Renee's going to be our CGM model. Go ahead, put that bad boy on a video. And yeah, I used one under Dr. Ovadia's care a while ago, and it educated me about what time of day to have carbs, how much carbs I could have, if I was going to be a couch potato that day, if I was going to go for a run and be really active, what did that mean, what time of day, and it gets you this whole personalized understanding of your individual biology, which it's all well and good to say low carb is good for you, and that's true, but understanding for you, when can you have this or that, or when can you have that apple, and how does that relate to something else?
Mm-hmm.
Utterly fascinating. Some of you folks are just joining the practice or just joining the health coaches. Talk to us about getting you CGM so we can help you understand better your individual biology.